Examination of the knee. The aim of this video is to introduce students to the examination of the knee. The objectives are to demonstrate the ability to examine the normal knee, to observe and identify normal gait, perform tests of range of motion for the joint, and to perform tests for integrity of ligaments of the knee. Start by introducing yourself to the patient and explain the reason for examination. Inspection should be done with the patient adequately exposed. We should be able to view the thigh muscles up to the groin. Remove all footwear. Ask the patient to stand and observe from the front. Look at alignment and observe the position of the patella with respect to the ankle joint and foot. Observe for scars, swellings, and the presence of quadriceps muscle wasting. From the sides, look for flexion or hyperextension deformities, scars, and swellings. From behind, look at the attitude of the knee on standing. Also observe for scars, swellings, calf muscle wasting, or popliteal cysts. Ask the patient to walk a certain distance, stop, turn around, and walk back. During the gait observation, look for the position of the shoulders, whether they sway to the side or drop on one side. Look for any abnormal knee movements such as thrust or giving way. Also comment on pelvic tilt and movement if it is visible. The gait cycle consists of stance and swing phases. Each phase has characteristic features in the gait cycle. Try to identify these features in the following video. Ask the patient to lie down. Observe the attitude of the limb in the supine position. Comment on any obvious quadriceps muscle wasting and swellings. Inspect the parapatellar gutters for fullness. Fullness of the gutters indicates the possible presence of effusion. Feel for temperature over the knee joint with the dorsum of your hand. Determine if effusion is present by performing the patellar tap or fluid shift tests. The patellar tap is performed by compressing the suprapatellar bursa with one hand. The other hand pushes the patella downwards. The sign is positive if you can feel the patella sink and taps on the underlying femur. To perform the fluid shift, use your hand to massage any fluid in the anteromedial compartment of the knee into the suprapatellar pouch. Next, stroke the lateral side of the knee and the suprapatellar pouch to push any fluid back into the anteromedial compartment. Bulging along the medial parapatellar gutter indicates a small effusion. When palpating for tenderness, remember to look at the patient. Start at the tibial tuberosity and move proximally. Feel around the patellar tendon, tibial plateau, the joint lines, femoral condyles, and quadriceps tendon. If any swellings are noted, palpate its consistency, whether it's boggy, soft, or hard. Assess active range of motion of the knee and quantify in degrees. Compare the range with the contralateral limb. Feel for crepitus during the active range of motion testing. Assess passive range of motion if there is a limitation in active range. Identify abnormalities such as fixed flexion deformities or extension lag. In the presence of a fixed flexion deformity, you will not be able to passively extend the knee fully. However, an extensor lag is present when you are able to passively extend a flexed knee. Place the knee in 90 degrees of flexion. Tell the patient that you will need to sit on his or her foot to stabilize the limb. Observe if there is any sagging of the tibia posteriorly and check for medial step-off. Place both thumbs over the tibial tuberosity. Using your index fingers, relax the hamstrings behind the knee. Give a gentle anterior pull to assess ACL and push to assess PCL. The test is to be repeated on the contralateral limb for comparison. To perform the Lachman test, place the patient's knee at 30 degrees of flexion. Usually this is achieved by placing your leg flexed on the bed and resting the patient's leg on yours. Stabilize the limb by placing one hand on the distal thigh. Gently hold the leg at the calf muscle and pull forward, eliciting any ACL laxity. Gently lift the leg, holding the distal third of the thigh. With the knee in full extension, give a valgus stress and assess the laxity of the MCL. Give a varus stress and assess laxity of the LCL. Next, flex the knee to 30 degrees and repeat the tests. McMurray's and Apley's grinding tests may be done to elicit meniscus injuries. However, joint line tenderness would be an easier option. Conclude the examination by thanking your patient.